Officer, and can I thank all those members who are taking part this evening and also those who supported the motion to allow it to come to the Chamber this evening. Problem gambling is a serious public health issue. It has far-reaching consequences for individuals, families and the wider communities that we all represent. A public health issue requires a public health person-centred response, and that is the framing I would like to have for this debate this evening. Problem gambling and addiction more generally doesn't just impact on finances, it can have serious implications for the health and well-being of not just the person with the problem, but their immediate friends, family and loved ones. It can cause financial ruin, it can result in health and well-being issues, and people experiencing problem gambling face a stigma and judgment that can put people off seeking the help that they so desperately need. Loss of employment, debt, deterioration of physical and mental health can lead to increased risk of suicide amongst individuals affected by problem gambling. Indeed, I've reflected on my own framing for this debate, and I know from working with some brilliant recovery charities in Motherwell and Wishaw that terminology is important and it can be charged if it's not framed correctly. Understand this can be stigmatising in itself. It felt necessary in the context of raising awareness of support for most problematic cases. I must also consider my own language in terms of empowering people rather than judging, and empowering them to seek that help. A public health response, as is the case with drug and alcohol use, is about framing these debates as a person-centred, awareness-raising, compassionate response to problem gambling. We are not going to end gambling. It's practically as old as humanity, I would suggest. But we can recognise that if it gets out of control, that there is help for those struggling. People will continue to gamble, but according to Public Health Scotland, 58% of adults aged 16 and over have gambled within the previous 12 months. I do not accept that betting companies have done all they can to reduce those harms. According to the Scottish Health Survey in 2020, around 55,000 people are estimated to be experiencing severe gambling problems, with a further 3.8% at risk of developing gambling-related issues. And they go beyond, as I have already said, the individual. It is estimated that for every person affected by a gambling problem, there will be 6 other people in their family and friends and working environment that will be deeply affected by it too. And we know this is not a gender issue. We know that there are female and male people struggling with addiction in this area. Although I have to say that the targeting from the organisations that offer the opportunities is very different and gender-focused. A person's life and livelihood can be devastated, and this can impact on everyone round about them. But there are wider social harms too. It can cause financial desperation, which can lead to associated crimes. GamCare, who work in my constituency and indeed attended the recent Community Action Network that I held, hosted by New College Lanarkshire, where we bring together third sector organisations to share experience. They presented at that, and their annual statistic report shows that more than 50% of individuals seeking help for problem gambling also reported committing criminal acts to fund gambling activities. I would like to commend those organisations who are doing work in the community, and the profits invest, and a lot of the gambling companies will invest in these charitable programmes, and I do welcome that funding. But we have to get to the crux of the matter, and it does not address the array of harms that are caused by problem gambling. Organisations which promote or market gambling also have to consider their responsibilities to the wider community. Sports clubs which take advantage of ad revenue from gambling companies should think about the impact that messaging is happening on their fans. I know that teams are struggling, and I know that many clubs position themselves at the centre of their community, including Motherwell Football Club. It's a prime example of in my own constituency in terms of its incredible community work and fan engagement. As also with Wishaw FC, formerly a juniors, now semi-pro side. But many sports clubs, by chance or design, have a unique social role within their communities. That role gives them, in my view, a serious social responsibility, and decision makers should consider whether the revenues are worth it, knowing the harms and problems that can be done to the fan support base, and indeed some of the players, which we have seen. But it's not a unique sports problem. Gambling takes many forms: scratch cards, lottery bingos, games and mobile devices, as well as the more traditional sports and casino games. Our high streets are full of betting establishments, many of which also will have fixed odds betting machines in their premises. And I know my colleague Stuart McMillan, who's here for the debate this evening, has done a lot of work on highlighting the dangers of these fixed odds machines. Yes, certainly.
McMillan.
I thank Claire Adamson for taking the intervention. Just on the fixed odds betting terminals, one of the arguments that the bookmaking companies put forward at the time when they were campaigning to not have any changes to the fixed odds betting terminals was the fact that they claimed that stores would close, jobs would be lost, and it would have a financial detriment to their businesses. Is Claire Adamson aware of any of these claims that have actually happened, or were they really just false claims by that industry?
Yeah.
Claire Adamson.
I think the industry has been very defensive of its position in these areas, but I am not aware of any fewer betting establishments in operation, certainly in my constituency. Can I just finish, Presiding Officer, by highlighting a drop-in event that I'm having tomorrow after FMQs, where GAM Aware and the Simon Community, RCA Trust and the John Hartson Foundation will be here to talk about real-life experiences of gambling problems and offer that help and raise awareness of the help amongst my colleagues of what's available out there when people are in need. Thank you.